Response to hydroxurea in case of sickle cell disease. I am Dr. Jyotish Patel, sickle cell expert from India. Whatever I am going to say about hydroxurea in this slideshow is based on evidences, is based on experience, and is also based on wisdom. One of the question is hydroxurea response same in every case? The answer is debatable. Response in every case is different because every case has different genetic background. We know for sure that sickle gene is one of the 25,000 plus genes which person with sickle cell trait and disease has. The expression of sickle gene depends on rest more than 25,000 genes too. That is why the efficacy of hydroxurea also depends on individuals' genetic background. Hence, the response of hydroxurea differs from case to case. Next important question is, what can be the ideal dose of hydroxurea? The ideal dose is one which can give maximum benefit to sickle cell disease case without side effects. Rather than looking at level of fetal hemoglobin and hemoglobin S, one should look at the improvement in a case with the dose given. If patient is able to maintain stable state hemoglobin with significant decrease in episodes of sickle cell crisis, I think that would be the best criteria to judge about the dose of hydroxurea. So, the given dose, if well tolerated and patient doesn't manifest with side effects of hydroxurea, one should continue with that particular dose for a long time with every 3 months evaluation of the renal function, hepatic function, and required other hematology to monitor and to know about the possible side effects occurring due to hydroxurea. One of the biggest debate is age of starting hydroxurea. The ideal answer would be when case becomes symptomatic, because every case suffering from sickle cell disease do not have symptoms, do not have issues right from birth onwards. They become symptomatic at variable age because of many different factors. By way of own genetic background, every sickle cell disease case remains asymptomatic. Genes other than sickle cell benefited case to remain symptomatic for certain time, for certain years. Maybe the present science is unaware of such genes and may need many more years to recognize it. Just looking at the value of fetal hemoglobin and starting hydroxyurea needs rethinking, needs revised thinking, because often it is seen, it is observed that a case with sickle cell disease having low fetal hemoglobin level, they have remained symptom free for quite a long time. We should know for sure that anti-diabetic drugs, anti-angina drugs are not started in a case having positive family history. Likewise, in sickle cell disease case also, one may wait for appropriate time to start hydroxyurea therapy. Do I need to take hydroxyurea daily? The answer is yes. If one takes hydroxyurea on daily basis, the drug level is maintained all throughout 24 hours. The reason why hydroxyurea is given on alternate day or twice a week is because of non-availability of the pediatric dose formula, may it be in a tablet form or in the syrup form. If patient takes hydroxyurea on daily basis, patient is at advantage. Drug levels are maintained 24 hours and the maximum benefit of hydroxyurea can be achieved. The next question is it an OTC, means over the counter product? Can you go to the medical store and ask it? The answer is no. It is not an OTC product. Every case needs prescription and precise monitoring at 3 months interval, because this is the drug which requires proper monitoring of beneficial and deleterious side effects of this product. That is why my humble request would be, just do not take it without its prescription and proper monitoring. Can I get hydroxyurea without doctor's prescription? No. It cannot be over the counter product, as I said earlier, because doctor must examine a case, get hematology done so as to judge good or bad effect of a drug. Hydroxyurea should be prescribed by a doctor who knows about the dosage, when to modify the dose, and the modification of the dose should be based on weight of the patient, wellness of the patient, age of the patient, and there are so many factors we need to consider. Hence, it is always good to get a proper prescription of a doctor who knows about sickle cell anemia, and he prescribed the proper dose so that patient can be benefited to maximum. What happens if I stop hydroxyurea? Stopping hydroxyurea may not bring immediate threat, but the case who was taking it may lose its advantage by not taking it. The reason is the advantage fades gradually. If hydroxyurea is taken irregularly, and that too in inappropriate dose, it does not give required advantage to a case. So this is the reason why there is a definite role of sickle cell expert, of doctor who knows about sickle cell, to decide about the appropriate dose for an individual case so that patient can be benefited with this drug to a maximum. There are so many doubts about the use of hydroxyurea, and one of it is, can it be taken with other drugs? Hydroxyurea is one of the most tested drugs of sickle cell disease. It is better to avoid mixing of drugs with other medicines, which could be just a supplement and not a real drug which gives you advantage. Multiple medicines may not bring maximum benefit. It is a desire of every case to have maximum advantage of multiple drugs, but one forgets the fact that any single drug used in an appropriate dose with regular usage of it can get maximum advantage. Let me tell you about my wisdom of using hydroxyurea, that it is a drug which is less used, which is prescribed less frequently, and what is most important is one must give proper dose and one must take it on daily basis. Myth about hydroxyurea. With use of social media and electronic information, a sufferer is becoming curious and at times furious. They are worried about drug toxicity and safety of a medicine. There is a misconception that allopathic medicine are more toxic than the other pathies. This is not true at all. In fact, allopathic drugs are most evaluated and they are the most safest because they have passed through phase 1, phase 2 and phase 3 trial. They are scientifically evaluated. My advice is, take hydroxyurea regularly and judiciously in a dose which is prescribed to you by a doctor who is well aware about sickle cell issue. What is needed today globally? Every country must make it available to every single case of sickle cell disease and use it judiciously. Sickle cell disease case needs to be managed by a skilled doctor, nurse, who are specially trained and they are certified to manage sickle cell issue. We know for sure that skill is a backbone of success. Treatment by unskilled doctor and nurse may does more harm than good to the patient. And lastly, outcome of a sufferer depends on the holistic approach. So with skilled manpower, there is a need of family support, society support to give better, healthier and happier life to case of sickle cell disease. Friends, many questions are answered in a simplest way by me. Still, if you have any query, you can mail your queries to sicklegujarat@gmail.com or log in to website shishudiphospital.in. I hope you like this information. which is given to you, and if you like it, do not forget to share in your group. Thank you.